It's a pleasure for me to be here. Thank you very much for this kind invitation to come to the CRY conferences, which I followed for years, and I'm very much impressed by the work that CRY had done. This is my hospital in Norway. We don't have this broad experience and very clever groups as you have in Britain. So, I have no conflict of interest to declare, other than a major interest in this issue. You have seen these pictures before, and I'd like just to say one point. A usual lecture with both of his pictures saying that I have a lot of pictures which illustrate my point. A lecturer into sports cardiology would say, sadly, I have too many pictures that all too well illustrate my point. And it's many of them, and every one of these sudden cardiac arrests in athletes has their story, and every of them has the opportunity to learn something to us. And if we may proceed further in the work from the sudden cardiac arrest, how to prevent and how to reduce the burden of this, we need information. And you have had a lot of information. You've heard a lot of information on this conference about incidences. How frequent is these events? Just listen to the very nice talk of Stevie, which provoke the present understanding of the incidents. Also, the etiology, what is the causes of this, so that we can come in a position to reduce the sudden cardiac arrest in athletes. And there is one main point. Even if we have a lot of knowledge, we need more precise knowledge. And now I come to my point. If you look not at the materials and the results of the materials, but if you look on the methodology of the materials, we should do that more often, you find a large variation between materials. In incidence, it's range between, let's say, 1 in 40,000 to 1 in 200,000. That's a ratio of 5. It's a huge variation. And if you scrutinize, you find both that the numerators and the denominators are very imprecisely described. Look at the American data from Barry Maron, for example. It's only voluntary reporting of the incidences, and the population is very badly demarked. Also, the registration method varies a lot. Very few prospective studies, many retrospective studies, voluntary reporting, as we mentioned, and some studies rely on media report only, which we also have mentioned. It's a gross underestimate of what the actual incidence is. Also, when you see at the causes of sudden cardiac arrest in athletes, Sandai has described the different kinds of major causes, you find that there is a large variation between countries. So we are in a situation where the data is very much a big range between the data. Also, you find surprisingly imprecise definition. What is an athlete? If you are a scientist, how would you define an athlete? Go and look to the papers. It's very difficult. It's very imprecise. The definition of an athlete, which we are talking about, varies from such kind of definition to such kind of definition. It doesn't function when you look at these pictures very scientifically. Also, the definition of sudden varies a lot. Does sudden mean during sports? Does sudden mean within 1 hour post-exercise? Does sudden mean within 24-hour post-exercise? Also, the definition of young varies considerably. Additionally, the available data cover smaller region. Also, the Italian data only covers less than 10% of the Italian population. It's very few national data. And no study covers larger region like a continent. For example, the European registry of sudden cardiac arrest in sport doesn't exist. We don't have it. And therefore, meta-analysis is impossible to conduct due to the heterogeneity of the method which are used. Also, we find lack of information about the circumstances related to the sudden cardiac arrest in sports, the site of the event. Where does it happen? The cardiovascular preparedness of the site of the event, if it was a sporting facility. Also, the emergency response intervention. And it's a lack of information about the outcome. The genetics, the CRY has been pioneers in the genetic way, examining first-degree relatives to identify family members who may carry the same risk as the target victim. Also, you have been a pioneer in the last point here, the burden of the relatives. I think we have work to do there, really. So, knowing the magnitude of the problem is essential to estimate the cost effectiveness of screening. And Stephen has very nicely shown that, I mean, this is rather a mess, just to say. The crucial question, the really crucial question is, this variation which I have shown and which this conference has shown, are the variation true? Or are the variation due partly to methodological weaknesses? We need to know that. Just one example. This is several materials of sudden cardiac death in the young athletes, and you can see the countries where the materials originate from, the first author, if it's athletes, where it's published, and look to the right column. Look at these variations here between percentage of coronary artery disease as the cause of sudden cardiac death in young athletes. Huge variation. And we can go through different kinds of materials of coronary artery disease or just sudden cardiac death. You find the same large variation. So, it's a pressing need for a uniform way of registering exercise-related sudden cardiac arrest. And one might think, why not make a worldwide registry? It's needed, yes, but we found that it's unrealistic due to the dissimilarities between countries in tradition, in ethical views, in laws, etc. However, uniform definition and uniform registration is possible to apply internationally. And that might form basis of national registries. It might make research reliable and more frequent. And it might gradually make meta-analysis feasible to conduct. So if we can come to a position where we make uniform registration based on uniform definition, it would be a great step forward in the understanding of sudden cardiac death in sport. So this research is for the future. Therefore, this article has been written. It's called Sudden Cardiac Arrest in Sports, Need for Uniform Registration. And it's presented as a position paper for the sports cardiology section of the European Association for Cardiovascular Prevention and Rehab. And the article, firstly, criticized the views of the methods which I used. And secondly, the article presents suggestions for further improvement. The article presents precisely suggestions for how a registry should be set up. To put it plainly, the article is a cookbook, how to do registration of sudden cardiac arrest in sports. So if a country or a large body or large organization want to set up a registry of sudden cardiac arrest in sports, this article is the recipe. Just to come back to one of these points, what is an athlete? It's easy. What is an athlete? We all have an understanding of an athlete, but scientifically, the precision of the understanding of an athlete is bad. It's just an extract how we have done it in the article. We have differed between high intensity, moderate intensity, and low intensity, and precisely said what does that mean, meaning in terms of exercise hours per week. We have differentiated the competitive athletes, which should be placed in organized team or individual sports requiring systematic training, regular competition, and on a high premium on athletic excellence and achievement. And the professional athletes, they are competitive athletes, pay-to-play, team-based, or individually, even if they may have part-time work to make a living. And also define the leisure or amateur athletes, most frequently middle-aged senior, participating in various informal recreational sports, exercise levels modest to vigorous, on regular or inconsistent basis, but not requiring systematic training or the pursuit of excellence. May be engaged in lifelong or intensive physical activities similar to competitive athletes. The paper further advocates standard definition of athletes, as I've shown, of incidence calculation, how you should do it. The very important point, how to ensure a complete enrollment of cases, also taking into consideration gender, ethnicity, as the CRI very nicely have done, and of course the age of the athlete. Likewise, the type and level of sporting activity. You know, the Americans have shown that incidence of sudden cardiac arrest is higher when increasing the level of sport. Also, it's a precise instruction for autopsy practice in case of sudden cardiac death, including molecular samples and including evaluation of possible doping. And I have to add, after so many years of suspected case stories, the influence of doping on sudden cardiac arrest still is not well accounted for. A registry does not function without a framework, and I think that the work so far during the sudden cardiac arrest work has been done nicely scientifically, but the frames, the organizational frames of the work, we have something more to do there. Also in Britain, as Stephen told about, and in other countries, what is the organizational frame of our work? And we think that for a registry, the authorities should be responsible. And I think that as a future aim, it might be possible to integrate the sport-related sudden cardiac arrest registry in existing death certificate systems. Also, we have to take into account the ethical and legal aspect of developing registries very much between countries. And we need to collaborate. We need to make networks with, for example, Institute of Forensic Medicine and other kinds of vital forces working into this field. Genetic counseling of relatives and psychological support to the bereaved is necessary. And there are some small experiences with establishing a website, and the experience is good. The website might have a professional access, that means doctors, institutes, etc. And it might have an observer access, that means relatives, coaches, journalists, football trainers, who might report cases, which of course later has to be quality assured. And then the question of mandating a reporting system. It would be an advantage looking at it scientifically. But of course, it depends on cultural and legal conditions, so that have to be adapted to the traditions of the specific country. However, I think that all the sporting institutions should urge to make it obligatory in some way. And the last point here is important. I mean, everybody of us, which are researchers, want a registry. Nobody wants to use too much time to fill in reports into a registry. That's the main point. So we have written that the health personnel, which is in time constraint when completing registration form, must as a minimum fill in the ID of the victim and the date of the event, so that later researchers can find these cases and pick up information. This is a very important point. If you look in Europe, I've tried to get information about registration. What is the compliance to the registration? You get a pattern. When the registration is easy, the compliance is high. When the registration is too comprehensive, the compliance is low. So you have to adapt to this and put the focus on this problem. Also, if you want people to submit cases to this registration and to this registry, we have to uphold the necessary motivation. We have to encourage repeatedly that please do report cases into the registry to get it complete. Utstein criteria, that I reckon that you know about it. It's a uniform way of reporting data from in and out of hospital cardiac arrest. It was founded in 1991, and it was revised in 2004, and read what the title said. It's an update and a simplification. There you have it. It's a simplification of the Utstein template. Also, look here. This is supported from very strong medical bodies, and I think it's several bodies which have supported it, but this was the one who was written in the article, so that it had a strong organizational support and a strong organizational framework. And the Utstein criteria has been a success, no doubt. The later years has given us much more precise knowledge about sudden cardiac arrest in hospital, out of hospital, due to uniform registration, which the Utstein criteria, which is used all over the world, has presented. What is Utstein? Why this peculiar name? Utstein is an old abbey, like the water, yeah, close to the water, but I don't need to. It's lying here in the west coast of Norway, a rather beautiful place. And it was built at a time when the Vikings went to Britain to go to boarding school to learn proper manners, which they certainly didn't have. Luckily, in Norway, some peaceful Norwegians were left to build the Utstein Abbey, which 800 years later hosted a conference of acute care specialists to establish the Utstein criteria. So that's the story. This is the registration form which we have suggested. It's adapted and modified from the original Utstein criteria. First, you see information about demographics, age, gender, ethnicity, country of origin, then the location of the cardiac arrest, and if it was on a sporting facility, were there written medical action plan, were there an AED, also information about the sports, what kind of type, what kind of level, cardiac arrest during exercise, during elite competition, non-elite competition, during training, within 1 hour post-exercise, within 24-hour post-exercise. What was the exact time? Or, as we have seen several times, cardiac arrest unrelated to exercise, but within an athlete. Also, prior symptoms, whether present, whether any prior cardiac screening, and if yes, was the candidate found eligible for sport, yes or no? Was there any resting ECG prior to the death? Was there any correction procedure like ablation, surgery, pacemaker, etc.? And what about the family history? So, to the resuscitation detail, was the sudden cardiac arrest witnessed by either bystander or emergency personnel? And was there given any CPR by either bystander or emergency personnel? And if AED, what was the initial rhythm? BFVT, asystole, or PEA? And when did return spontaneous circulation occur in number of minutes? And lastly, what was the outcome? Died in the field, in the emergency department, admission to ICU, discharge alive or not? And what was the final diagnosis, either from the medical records for the survivors or from the autopsy report from the death, from the core lab or a local lab? That's how we so far have put it. So, to the research fellows here, I understand that this conference is a training also for research fellows. This is the old classical question about research quality. If you put low quality data into a registry, you get low quality results out of the registry. In Norway, we call this crap in, crap out, KIKO. And we should, of course, move towards gold in, gold out, GIGO. Some very modern of you go for GAGA instead of GIGO. I'm not one of them, but I will revise my view on that when growing more mature. So it's prudent to adopt uniform registration of record. And we think that uniform standard registration would present a step forward and enabling comparisons between countries and providing more scientifically based decisions concerning the safety of athletes. So, thank you very much for your attention.